Welcome to Clinical Tools Library, evidence-based scales and questionnaires designed to support healthcare professionals in practice. The Child Behavior Checklist assesses a wide range of emotional and behavioral problems in children and adolescents. It evaluates internalizing problems such as anxiety and depression, as well as externalizing behaviors including aggression and hyperactivity. The tool is designed to identify symptoms related to common disorders, like attention deficit hyperactivity disorder, conduct disorder, and mood disorders. Its main purpose is to provide clinicians and researchers with standardized information to guide diagnosis, treatment planning, and outcome monitoring. The assessment relies on caregiver reports to gather comprehensive data on the child's functioning across multiple settings. The Child Behavior Checklist is indicated for children and adolescents aged 6 to 18 years, presenting with emotional and behavioral concerns. It is most useful in clinical settings requiring standardized assessment of internalizing problems such as anxiety and depression, as well as externalizing problems including aggression and hyperactivity. The tool aids in identifying symptom patterns for diagnostic clarification, treatment planning, and monitoring outcomes. It is frequently utilized in outpatient mental health clinics, pediatric practices, and school-based services. The checklist complements clinical interviews by providing caregiver-reported behavioral data across multiple domains. The Child Behavior Checklist consists of 101 items designed to assess behavioral and emotional problems in children aged 6 to 18 years. Each item describes a specific behavior, and the respondent rates how true each statement is of the child over the past 6 months. The response format uses a 3-point Likert scale with options scored as 0 for not true, 1 for somewhat or sometimes true, and 2 for very true or often true. The checklist is typically completed by a parent or primary caregiver. Upon completion, raw scores are calculated for multiple syndrome scales and broadband scales, including internalizing, externalizing, and total problems. These raw scores are then converted into T-scores using normative data based on age and gender. T-scores below 64 are generally considered within the normal range. Scores from 64 to 67 indicate borderline clinical problems, and scores above 67 suggest clinically significant behavioral or emotional difficulties. Interpretation should also consider the child's developmental level and any cultural factors that may influence behavior reporting. Sensitivity refers to a test's ability to correctly identify individuals with a disorder, while specificity indicates the ability to correctly identify those without the disorder. For the Child Behavior Checklist, sensitivity values vary depending on the targeted diagnosis, but generally range from approximately 0.7 to 0.9. This means that the checklist correctly detects between 70% and 90% of children with behavioral or emotional problems. Specificity values also vary, but are often reported between 0.6 and 0.85, indicating that between 60% and 85% of unaffected children are accurately classified as not having issues. For example, in the case of detecting attention deficit hyperactivity disorder, a sensitivity of 0.8 and a specificity of 0.75 would mean that 80% of children with the disorder are identified by the CBCL, while 25% of those without the disorder may be incorrectly flagged. These metrics demonstrate that the CBCL is a useful screening instrument, but requires supplemental assessments for diagnostic confirmation. Developed in the early 1980s by Thomas Achenbach, the Child Behavior Checklist was designed to provide a standardized method for assessing behavioral and emotional problems in children aged 6 to 18 years. The instrument has undergone extensive psychometric evaluation, demonstrating robust reliability and validity across diverse populations and settings. Internal consistency coefficients typically exceed 0.9, indicating excellent reliability. Test-retest reliability studies, conducted over intervals ranging from 1 to 4 weeks, have shown stability coefficients generally above 0.8. Construct validity has been supported through factor analyses, confirming the presence of empirically derived syndrome scales, such as anxious, depressed, social problems, and aggressive behavior. Criterion validity has been established by correlating the checklist scores with clinical diagnoses and other established measures of child psychopathology. Cross-cultural research involving samples from more than 30 countries has further demonstrated the checklist's utility and reliability across different linguistic and cultural contexts. Longitudinal studies have also provided evidence for the predictive validity of the child behavior checklist, as elevated scores have been linked to later psychiatric diagnoses and functional impairments. Collectively, these data support the instrument's status as a scientifically grounded assessment tool widely employed in both clinical and research applications. Thank you for watching. For complete information and official PDF resources, visit clinicaltoolslibrary.com or check the link in the description below. And don't forget to like and subscribe for more clinical insights.